Welcome to Boombastic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Welcome to Boombastic Health. I'm Bradley Bostic, your host. We're in the wild here at the Health 2025 conference as the exclusive podcast of the Diagnostic Zone. I have a lot of friends that I've met through my years in healthcare, and one of my favorites is Dr. Lior Rauchberger, who is the CEO of Gene by Gene. Thanks for being here.
Brad, great to be here.
And I know you probably all think that this is a Kentucky accent, but Lior is actually from Australia and is actually running what I see as maybe the least known massive scale diagnostics company on earth, largely because you're behind the scenes powering genomic testing for players like MyHeritage, who they are doing massive scale, and you created the most efficient genomics lab I've ever seen to support that kind of volume. Would you say that's fair?
Yeah, like we've been at it for a long time, but yeah, last year we would have done 1.2 million DNA extractions and tests. That's a lot of volume. So we've just invested heavily in robotics, automation, sequencing machines. Yeah, and I think if we're not we would be one of the most efficient labs maybe in the world.
And so tell me, we have a lot of folks in our audience that love entrepreneurial stories, love healthcare leadership, and we're all sort of sick and tired of people just bitching about the broken healthcare system. We're here to highlight those people who are doing something about it. And I think genomics are such a critical part of that solution, and making it affordable, making this scalable, making it approachable so that everybody can benefit is key. How did you actually get into this space, though? Because you have a pretty cool story.
Well, back in the day, I was a physician in Melbourne, Australia, where my family is, but I didn't last long as a doctor. Like I got seduced by the world of entrepreneurship pretty early. So I only probably lasted in medicine for about 5 years. So I've always been really passionate about medicine, healthcare. I love technology. I'm a real data nerd as well. So this is the ultimate fusion of all my passions. And so we were running this small DNA company in Melbourne, Australia. And one of our customers was this Houston, Texas company called Gene by Gene, which was started in 2001, really at the dawn of genomics. Very pioneering company, the two founders of that company, who when I met them were in their late 60s. And they came to me in sort of 2019 and said, well, not just to me, but they were ready to sell the company and they wanted to move on. And I put my hat in the ring. And we were lucky. We were very lucky. I feel very privileged that, 5 years ago nearly, we acquired the Gene by Gene company. And I was impressed on day one by how efficient their lab was and the level of robotics and software engineering, not just about the sequences themselves. And we've just gone from strength to strength over the last 5 years.
So I remember coming down and having a dinner with you guys in Houston.
Yeah.
And I also remember, I don't know if you remember this, but one of the founder that joined us for dinner was a graduate of my same high school in Omaha, Nebraska, the West Side Warriors. He was a bit older than me, so we weren't there together.
Yeah.
And he actually, our colors were red and black. And so he actually drove a red and black Tesla.
Yeah.
Because he was like such a fan of his experience at West Side High School. So, go Warriors.
Yes. And let's mention him. He won't be embarrassed by that. Yeah, his name's Bennett Greenspan. And Bennett's has been a wonderful mentor for the business, really the doyen of both the genetic genealogy and also like large volume sequencing. And he introduced a lot of innovation. And that's right. I forgot that story. Now you mentioned it, I remember, Brad. Yeah. He's still a shareholder in the company. He's still an advisor. He's wonderful.
Well, tell him this. I said hello. Make sure he watches the podcast. And hey, thanks, Bennett, for being a great West Side Warrior and representing. Appreciate that. So your business has evolved a great deal. And I know one of the things is you're going from arrays to whole genome sequencing increasingly, which I don't know, 10 years ago, that was unheard of. Talk to me about what's going on there.
Just seeing this industry transition, and really it's come about quite quickly. So if you were to ask me, Brad, in fact, when we first caught up a few years ago, we were probably doing 90% arrays. An array is just a segment of the whole genome, and 10% genome. That was the mix. Today, we're probably 70% genomes and 30% arrays. So that's a quick shift. And it's been a huge transformation to move from arrays to sequencing. And it's mostly been driven. I mean, there's been a lot of automation. There's a lot more, many more platforms to pick from. But effectively, people want more data because more data is more research, it's more finding, it's more insights, more personalized and precision medicine. And that's driven that. And the cost has come down tremendously in the last 2 years. And it's
So
exciting.
you can talk about it. You have a significant relationship in this ancestry testing world, and you're moving that to this whole genome space. What is unlocked in that specific niche by moving to the whole genome?
It's no different whether you talk about the ancestry or the geological. I mean, we also provide a lot of cancer testing now for some of our partners and cardiology. I mean, there's just so many fields. When you have the larger data set, you can get richer data, more breadth, more depth. So genealogically, people want to know, it's just higher resolution. Yeah. So in the genealogical world, in the old world, we might be able to tell you who your second cousins are and maybe who your great grandfather was as an example. When we move to the high resolution of sequencing, we can go 3 or 4 more generations deeper.
Okay.
And so we can go, so rather than just telling you your great grandfather, maybe tell you your great 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 grandfather was. So it's just the quality of that data. And in the clinical world, if you talk about cancer and oncology, we're going to identify more cancers. We're going to be more prescriptive about prognosis and diagnosis. And we're also very heavily involved in the medications world around pharmacogenomics. So the more data we have, the more drug gene interactions we can talk about. So it's
One of the things I've been impressed with the gene by gene business is the way that you've consumerized the approach. And I know that firsthand because we have a portfolio company that I co-founded called DecisionRx, which is focused on ensuring that individuals are on the ideal medications. And this is in the value-based care risk-taking environment in the United States. We've now got about 1 million members, I think it's about 1.3 million members that are actually under contract. And that is a pretty significant population that the only way to fully optimize their medication regimen is to look in concert with all the risk factors inclusive of their genomics. So DecisionRx needed a solution to make it so that when an individual receives this test kit and their insurance provider and their primary care doctors are asking them to return it, it was packaged up in a way that's very easy to use. And then once they actually responded with their buccal swab or this big Q-tip, basically used to rub your cheek, they send it back. The lab needed to return that result quickly, but also at a reasonable cost.
Yeah.
Because we're dealing with a situation where we have to incorporate all this action based on the data to get people on better medications and then ultimately get paid once it's realized that there are savings because they're on the right medication. That's a whole long preamble to say firsthand works with gene by gene. And we're seeing that the level of coverage you have in terms of alleles and the genomic, construct you're delivering so much broader than what we see from other labs at a lower cost. And it's consumerized. And what I've seen is these other labs have built panels specific to what's getting reimbursed.
Yeah.
And what you folks have done is built the thing that's maximizing the potential capability of the technology and then optimize for that. And I don't really see other folks doing it that way.
No, you're absolutely right. And there's 3 things. I mean, we are winning because of the 3 things that are really driving. It's in our DNA, no pun intended, right? Mentioned price. It's all about, the more we can drive down the price, we're all good. The tide's going to rise for everybody. Yeah. So it's about access and equity and inclusion, which is so important. Turnaround time is constantly improving. Like tests that we were reporting back that were taking us 10 business days, we've now got down to 2 or 3. So huge reduction in turnaround times. And the other thing is what I call flexibility or modularities. We have lots of different partners. We've probably got 100 plus partners now that we have contracts with. They all want something slightly different. Yeah. They say you might still do a whole genome test, but we want the panel to do those markers or those genes, or you mentioned those alleles. So we are customizing in a very modular fashion, very cost efficiently and very quickly, a whole multitude of DNA testing. Yeah. And that's winning us a lot of friends.
Sure.
Yeah.
So how big is this opportunity? How many are we just scratching the surface? Like if you look out into the future, does this kind of genomic testing become commonplace for every single individual? And it's like not having a social security number in the United States if you don't have your genome sequence.
That's what I talk about. I mean, that's my vision. And, if you asked me a few years ago, I've been talking about this vision for a long time, but I never quite could see the light at the end of the tunnel, if you want to call it that. Like, we've been swimming in this exciting ocean for a long time. It feels like the waves are now forming and breaking. Like, we have been inundated with opportunities. But my vision, if we're getting the whole genome down to $100 or $150 in that, depends what you do. But yeah, I'd like every child at birth to have a whole genome test when you're born. And you never have to do that test again. Newborn screening for every child born. And importantly, I am all about democratizing data as well. And that data, that data belongs to that human being, that child or their parents. I'd love everyone to carry on their phones their personalized genomic health passport that they have for their entire lives. Yeah. And as they go along throughout their life, they would share that data. They hold the keys to that data and they unlock it with all their the companies they want to interact with, the healthcare providers they interact with, the pharmacy. That's my vision. And that world of sort of what I call life cycle genomics, it's coming quicker than I had hoped, which is wonderful.
Yeah, as you talk about that, the reality is the research related to the genome continues to progress and breakthroughs are happening all the time. And physicians, clinicians, they can't keep up with all of it. And the way that information is disseminated, once it is proven to be some correlation between your genetic traits and what's going to be predictive of some disease that you could potentially prevent or some other related issue with your genetics, hearing you say is, if we all had in this app on our phone, this secured genome of our own, and it was continuously in a secure way getting bounced against all of this research, you might see, hey, I'm predisposed for colon cancer, which like my mom died of colon cancer. If she had had that app, potentially would have said, hey, you've got this certain genetic mutation. You should go get tested for this because you are like a ticking time bomb for this particular disease. Is that fair?
That's absolutely what we're doing. And one of the most exciting fields is called polygenic risk score. So where we're looking at not just a single gene like a BRCA gene, but we're looking at tens of thousands of genes in combination, and people are doing all these algorithms. And AI is very important. Like, you walk around this conference and you see AI everywhere. Well, there's not many fields that AI will have such a profound impact as genomics and preventative healthcare. But polygenic risk score is just that, Brad, where basically we look at tens of thousands of genes and the combination thereof, and we say your risk of having a heart attack or a stroke or getting dementia or getting bowel cancer, even osteoporosis, is this percentage. And you might be, well, you're like the average population, or you've got a higher risk or a lower risk. And then we can do things about it. We can be proactive. We can have more aggressive monitoring. We can be, more diligent. And many of the clinicians, particularly in the area of cardiology first, if you think about cardiologists, a lot of doctors would see someone that they're not very high risk yet. Yeah. They might have slightly high blood pressure. They might have slightly overweight, but they don't necessarily need to be treated or be aggressively monitored, but they're in that middle band. Yeah.
Right.
And if we can do a polygenic risk score on them, that information can really help the physicians know, is this person actually low risk or higher risk because of the genes that they were blessed or cursed with inheriting from their parents. Yeah. And that's what this sort of exciting field of preventative genomics or preventative healthcare is all about.
Right. Very exciting. So you as an individual who is the CEO of this big genomics lab, do you have your whole genome sequenced?
Yeah.
And have you?
I always go back and look at it. It's just like you say. And you know what? I've been using AI. So I've built my own little server. So I don't want it up in the web. Yeah. And I ask questions using the large language models of it all the time. I don't know if you remember, but it was a few years ago on Netflix. Chris Hemsworth had this documentary and he made a little bit more popular the ApoE gene, which is linked with Alzheimer's and dementia. And so there's some specific genes, the ApoE gene, that if you have a particular variant, which is not that common, but you're about 4 to 5 times more higher chance of getting early onset dementia. And when I heard this, I wonder if I've got that. So I went and I interrogated my genome and I actually used some AI tools saying, hey, can you look through all these 3 billion letters and tell me what are my risks of early onset dementia? So yes, I have done my full genome, and every now and then, I'm still youngish and healthy, but I interrogate it because the research, as you said earlier, it is evolving. And no human being can read all the studies coming out. It's impossible. No. So we need to rely on machines to help us for that.
Yeah, I saw a study that said if a physician in a given specialty were to research and read 27 hours a day, they could almost keep up with everything that's coming out. So literally more hours in the day than exists. And that would require obviously a superhuman that had some kind of a, way to go into the metaverse. I don't know. So
Yeah.
this is the future though, I
It is.
think, is how do you use that predictive capability that helps you prevent disease and get ahead of it. Now, obviously there are certain things that you just need to manage because they're not a solution for you yet.
Yeah.
But it seems like there are a lot of opportunities to do things that are proactive. Like in the example of cognitive decline, I've had a number of guests who have innovations that are helping to reduce the effects of cognitive decline through various techniques, including some lifestyle changes. There's a lot of promise there. Obviously, there's praise with medications that can help people manage it more like a chronic disease. It's like with diabetes, where it used to be, if you got diabetes, like there was no real answer. You would just end up getting amputations and having this real struggle. Now you've actually got this ability to manage people who are in the, early stages of diabetes. So they have a healthy, long lifestyle. I think the same can be true for a lot of other things, including cognitive decline.
That's right. Right. I'll give you another example, Brad. It had worked out. And again, the science is less mature in the area of nutrigenomics, but it's emerging and it's growing. And I'm following it closely because nutrition and obesity is an enormous issue in Western societies. So I worked out, I've been married now for 22 years, and I'd worked out after I'd been married for about 15 years that I'd put on about a pound for every year of marriage, 1 pound of weight. And I'm a fairly big guy. So I'm in kilos, I have to convert, but I think I hit like about 220 pounds. I was too much. So I was carrying probably 22 pounds too much. And I sort of didn't really have the motivation to know what to do. So I uploaded my genetic data into this tool, and I said, well, what do you think the problem might be? Again, and it's not as mature science as in some of these other areas we've discussed, but I found it very insightful, and it actually changed my behavior. It instructed me or guided me saying, look, Leo, you've got a propensity for snacking a lot. You have a snacking gene. And if you're going to change your diet, why don't you try a higher protein diet? Not for everyone, but they said that my profile suggested. So I did. I reduced my carbs. I started having more protein. I noticed my appetite dropped a bit, and I lost 20 pounds.
Good for you.
And so it's not all about just the pure science of my genetic profile for that, but it definitely gave me some insights, and it nudged me to improve my lifestyle, and it's worked.
Well, there's no doubt that nutrition is such an important thing. It really, we focus on all kinds of things with healthcare, just as it relates to health. Sleep and diet are two pretty major medicines that if you just do those, and then you add a little exercise in there, that's helpful. But I hear what you're saying, and I think pharmacogenetics is an aspect of this where it's what can your body actually metabolize?
Yeah.
And in some cases, you might be supplementing and just getting expensive urine because your body can't actually metabolize.
Yeah.
So I think there's a whole world of opportunity there.
Yeah.
Well, it is so fun to have you on the podcast and to see how well you're doing. And I really look forward to our continued collaboration. Right now it's with DecisionRx and Gene by Gene.
Yeah.
But I think in the future, there are other opportunities as well. So thanks for coming on the podcast.
Thanks, Brad.
Awesome. And hey, thank you everybody for being here for another episode of the Boombastic Health Podcast. And right now we're in the wild live at the Health 2025 Diagnostic Zone. We'll see you next time.